Hello, welcome back. This educational video is specifically designed for patients living with chronic pulmonary disease, as well as their caregiver and loved ones, on how to identify and differentiate rescue medications from daily controller medications. It's important to understand what an exacerbation of symptoms means. Patients living with chronic obstructive pulmonary disease have daily symptoms of wheezing and typically shortness of breath. Those symptoms are usually controlled by daily controller medications. I have another video in my video library that explains all those, as well as medication technique and application. Please visit that video library. For the purposes of this video, I'm going to guide you through how to identify and differentiate your rescue inhalers and why you want to use those versus your controller medications. Flare-ups are very serious. Exacerbations can be scary. It can cause you to have to call your healthcare provider or go to an emergency room and end up staying overnight in the hospital. This video will hopefully help you and guide you and alleviate some tension and anxiety with regards to which inhaler do I take during an exacerbation. Let's begin. It's important to be able to identify on your prescription label which medication is your daily controller med versus your rescue inhaler. Rescue inhalers are typically prescribed with language such as inhale 2 puffs every 4 to 6 hours as needed. It's important to be able to recognize in emergency situations that your rescue inhaler is there to alleviate any apparent worsening symptoms, which include wheezing, shortness of breath, and other breathing difficulties. So you've identified your rescue inhaler, typically by the label where it says as needed. Instructions are typically very easily given that lets you know this is your rescue medication to differentiate from your daily controller medications. Other important factors that patients and caregivers need to understand is what are the triggers that exacerbate patients' symptoms. Oftentimes it could be pet dander, it could be perfume smells, the burning of candles, air fresheners, smoking can trigger a patient with chronic pulmonary disease. If your patient, your loved one, or you have an exacerbation of symptoms, which means your baseline wheezing or shortness of breath or even coughing is getting worse, you want to go ahead and administer your rescue medication. You want to do that with your spacer, okay? A lot of times what I encourage patients to do is to label your inhaler rescue. You want to keep this one with you at all times. This is your rescue inhaler. And a lot of times patients like to label it, I feel bad, or take in an emergency, or if I can't breathe. Whatever is going to be your gentle reminder this is your rescue med, I strongly encourage that you place soft tape across your rescue medication and label it accordingly. You're going to want to go ahead and shake up your medication and get it ready. With your spacer, with your hole facing up, you're going to put your medication inside the spacer, tight lip seal around the mouthpiece. Administer one breath, breathe in with breath holds of 1 to 3 seconds at the top of each breath. A good 2 to 3 breaths with a spacer should do it. A lot of times patients have different types of rescue medications that have been prescribed to them, such as nebulizer treatments, particularly albuterol, and you'll get them in these cellophane wraps in this little box, and they come with little tubules, and what you'll do is you'll administer into this medicine cup. You'll put it in there. You'll have your tubing, which will come off of your nebulizer, and you'll either have a face mask or a handheld device. In this case, I'm using this type of medication cup. Again, tight seal around the mouthpiece and just breathe in and out gently. You should have cool mist that comes out of the end of your corrugated tubing. That is proper use. It is also important to note that rescue inhalation medications are available through the use of nebulizer treatments and therefore can be used in a home environment during an exacerbation period. Please note that misting at the end of a mouthpiece is a normal occurrence, which means that the equipment is working properly. Now that we've discussed how to identify or rescue inhalers, as well as medication techniques and some other alternative administration via nebulizer treatments. It's important to note that limiting exacerbations is a key factor in managing your chronic pulmonary disease. So knowing what your triggers are and trying to avoid those triggers, such as pet dander, smoking, perfumes, burning of candles, air fresheners. It's also important to stay current and up to date on your yearly vaccinations, either being your pneumonia or your flu. That will help deter you from having worsening exacerbations, because as stated earlier, exacerbations typically occur because of an infectious process. I hope that you have found this video educational and informative. Please be sure to visit our video library for more information on nebulizer treatments, additional medical equipment, techniques, and use. Breathe easy, friends.